Hey everyone, welcome to this explainer. If you've just been prescribed Warfarin, you're probably looking at a massive mountain of new information right now. But don't worry, we're going to break down the exact science behind your new meds, why your doctor made the specific choices they did, and what you absolutely need to know to stay completely safe and healthy on your patient journey. Let's jump right in. So why is my starting dose so low? This is a super common question. You might have heard the typical adult dose is 5 milligrams, but then you look at your bottle and see a much smaller number. It's totally natural to think, wait, is my dose high enough or is there a mistake here? I want to reassure you right out of the gate. A lower dose is absolutely not a mistake, and it definitely doesn't mean your condition isn't being taken seriously. In fact, it means the exact opposite.
Section 1. The low dose explained. Decoding the numbers and colors. To really get a handle on your dosage, we first need to take a look right at that pill bottle in your hands. Look at how the standard 5 milligram peach tablet compares to the incredibly specific 2 milligram lavender and 2.5 milligram green tablets. Fun fact, pharmacy folks actually use color mnemonics to make absolutely sure they're accurate. So LET stands for lavender 2 milligram, and Granny stands for green 2.5 milligram. If you're holding a green or lavender pill right now, you're on what medical professionals call a sensitive starting dose. But what does that actually mean for you? Moving on to Section 2, why less is more, and the critical importance of precision dosing. Just because you see a smaller number doesn't mean your condition isn't serious. It means your treatment is entirely customized for your safety. The whole point here is to avoid excessive thinning of your blood. Warfarin works by thinning your blood to stop dangerous clots, right? But if it gets too thin, you're looking at a serious risk of internal bleeding. Your doctor is basically trying to find that perfect Goldilocks zone. Not too thick, not too thin. If your body is inherently more sensitive to this stuff, a standard 5 milligram dose could blast you right past that safe zone. Which begs the question, why might your body be more sensitive? Well, there are a few big factors. Are you elderly or frail? Dealing with malnutrition or a poor diet? Maybe you have a history of liver or kidney disease, heart failure, or honestly, even if you're just taking certain other everyday medications. If any of these ring true for you, your healthcare provider deliberately picked a lower starting dose because your body just reacts more strongly to the medication's effects. Section 3. The biology of sensitivity, or how your unique body processes the medication. Let's dig into the fascinating biological why behind your personal chemistry, starting with your heart. Hepatic congestion. This is a condition often caused by heart failure where blood backs up into the liver, messing with its ability to clear medications. So as blood backs up, your liver literally can't process the warfarin out of your system at a normal speed. The drug just kind of hangs around, continuing to thin your blood. And that is exactly why having a heart condition means you need that smaller, greener lavender pill. Now, comparing these vital organs shows us that whether it's reduced clotting factors from the liver or altered protein balances from the kidneys, your organ health dictates your ideal dose. Warfarin's whole job is to inhibit clotting factors made in the liver. So if your liver is already damaged, it's making fewer of them right from the start. You're essentially halfway to the finish line before you even take the pill, so you need way less medication to get the job done. The exact same logic goes for your kidneys, which balance those clotting proteins and process the drug. And hey, nutrition is a massive piece of the puzzle here too. Low vitamin K from a poor diet makes this medication significantly more potent. See, warfarin directly interferes with vitamin K, which is what helps your blood clot in the first place. If you're malnourished, your vitamin K levels are already super low, the medication just doesn't have to work as hard, which is why your doctor proactively scales your dose way back. Age and frailty play a really similar biological role. For older or frail patients, a lower body mass and a slower metabolism mean the medication simply hangs around in the bloodstream for a much longer time. A 2 milligram lavender dose gets the exact same job done and reaches the exact same therapeutic level as a 5 milligram dose would for someone younger or heavier. All right, Section 4, hidden medication interactions. We really need to talk about what else is in your medicine cabinet, because beyond your own biology, outside factors totally change the game. Everyday drugs can actually block the liver enzymes that normally break down warfarin. We're talking about things you just grab over the counter. When those outside drugs block your liver enzymes, your body literally stops breaking down the warfarin. It just builds up, creating a really dangerous blood-thinning effect without you even realizing it's happening. Here are some huge hidden interactors to watch out for. Antibiotics and antifungals, aspirin and NSAIDs like ibuprofen, St. John's wort, garlic supplements, and ginkgo biloba. It's crazy, but even natural herbal supplements can dramatically amplify the blood-thinning effects,
We usually think of natural stuff as totally harmless, right? But things like St. John's wort or garlic can completely change how your body handles warfarin. If you take any of these, that 2.5 milligram green tablet is absolutely the right, safe starting point for you. Finally, Section 5. Next steps with your doctor and taking charge of your therapy. Understanding all this biology puts you right in the driver's seat of your own health journey. Here's what you need to do. Step 1. Take a complete inventory of all your current prescriptions, over-the-counter painkillers, and herbal supplements. Step 2. Consult your doctor or pharmacist about exactly how they interact with your new dose. Don't leave anything out. Even a daily multivitamin or an occasional anti-inflammatory needs to be run past your healthcare provider to make sure your specific green or lavender dose stays perfectly tuned to your unique body. So what hidden interactions might be in your daily routine right now? As we wrap up this explainer, I really want you to go look in your medicine cabinet today and ask yourself that exact question. Because honestly, the safest patient is an informed patient. Take a few minutes to check for any of those hidden interactors we just talked about. By understanding exactly why your dose is what it is, you've taken a massive step toward a safer treatment journey. What's sitting on your shelf right now that you need to mention at your next doctor's appointment? Think about it, make your list, ask your doctor, and stay empowered.